Hi, everyone. Welcome to today's webinar. I'm Dr. Jody Jacobson Fry. I'm the co-chair of the Workplace Suicide Prevention and Postvention National Committee with Dr. Sally Spencer Thomas. We're excited to be here today to bring you a presentation on suicide rates by industry and occupation for 49 states in 2021. Today's speakers will be Dr. Deb Stone and Dr. Cora Peterson. I'll introduce them momentarily from the Centers for Disease Control and Prevention. But we thank you for being here for this important webinar, one that we're excited to have some updated data that really helps us understand the scope of the problem of suicide and the need for suicide prevention in various industries and occupations. So our two guest speakers today, Dr. Deb Stone is the lead behavioral scientist for suicide prevention at the Centers for Disease Control and Prevention, or the CDC, currently serving in temporary capacity, co-leading the development of the 2024 National Strategy for Suicide Prevention. Deb leads the CDC's suicide prevention team, which is focused on carrying out a public health approach to suicide prevention using data, science, action, and collaboration. Prior to her work at the CDC, Deb worked at the state suicide prevention in Rhode Island and Massachusetts, and also directed the National Center for Suicide Prevention Training. With over 20 years of experience in suicide prevention and authoring over 65 articles, books, and government reports, we're excited to have Dr. Stone here today as one of our presenters. And joining Dr. Stone is Dr. Cora Peterson, who's a senior economist at the CDC's National Center for Injury Prevention and Control. She leads our statistical analysis and decision modeling studies to support resource allocation related to injury and violence prevention. This includes studies on the comprehensive costs of U.S. injury and violence morbidity and mortality, lifetime cost of sexual violence, intimate partner violence and child maltreatment, healthcare costs related to substance use disorders, and methods issues, including how to improve cost estimates of hospital-based care, equity pitfalls in policies and data sources, and options to operationalize analytic methods for public health studies. So very excited to have you both join us today for this important webinar. Many of you know the guidelines for workplace suicide prevention are developed through a collaborative partnership with the American Foundation for Suicide Prevention and the United Suicide Survivors International. All of the national workplace suicide prevention guidelines are based on 8 guiding principles. You can see them here and at our website to learn more about them. And we also encourage employers and professional organizations to start addressing suicide prevention as a health and safety priority by enacting the 9 practices that encompass the national guidelines. And you can see them listed here. They are a multi-comprehensive approach to suicide prevention, including upstream at the top, midstream approaches in the middle, and downstream approaches at the bottom of the screen. Today's presentation actually touches on all of these levels as we think about the overall risks in the U.S. for industries and occupations. And without further ado, I'm going to turn it over to Dr. Stone and Dr. Peterson.
It's great to be here. So I would like to start by acknowledging our lead author, Dr. Aaron Sussel, as well as Dr. Cora Peterson, who's here, of course, and then the rest of our co-authors shown here. This slide shows data for 2021, the year of the data that we studied. In that year, suicide was the 11th leading cause of death in the United States overall. However, among people of working age, it was the 5th leading cause of death, shown on the right. In 2021, more than 48,000 lives were lost to suicide among people of all ages, with more than 37,000 of those suicides among people of working age. And then between 2001 and 2021, suicide rates in the general population increased by 32%, similar to the rate increase of 33% among the working age population. As we know, suicide is not caused by any single factor, but rather by a combination of factors at the individual, relationship, community, and societal levels. Examples of risk factors for the general population are shown here and include job, financial, health, relationship, criminal, or legal problems, along with mental health disorders, prior suicide attempts, loss of a loved one to suicide, and stigma related to help seeking. According to the literature, risk factors for suicide related to work may include low-skilled work, work-related access to lethal means, and job stress, including poor supervisory and colleague support, low job control, and job insecurity. And so understanding which industry and occupational groups have high rates of suicide can inform suicide prevention efforts. And so I'm going to turn the presentation over.
This is the third data year that we have analyzed these data by industry and occupation. This is the most comprehensive one that we've done in the most recent report. The screen is our prior report from 2016, so a review of those data. 32 states in 2016 indicated that the highest suicide rate among males was among the mining, quarrying, oil, and gas extraction industry. By occupation, of course, these are different ways to talk about jobs. By major occupational group, the highest rate for males was in construction and extraction. For females, the major industry group with the highest suicide rate was transportation and warehousing, with a rate of 10 per 100,000. And the highest rate among females by major occupation was construction and extraction, with a rate of 25.5 per 100,000. So in our most recent study that was just published, we used 2021 data, this time in 49 states, due to a change in the availability of these data and a more systematic approach to make these data comprehensively available by state through the National Center for Health Statistics restricted use mortality files. With the data from the 49 states, we were able to look at major and detailed industry and occupational groups. You'll see some of that breakdown in the next slides. And in the article, we have very comprehensive tables for you to be able to look up by detailed or general in industries and occupations. So again, looking at working age decedents 16 to 64 to inform workplace suicide prevention. So our methods with the most recent report, again, 2021 suicide data, we have data from 49 states. We are not able to look at Rhode Island or Washington, D.C. in the data that were available in 2021. We looked at industry and occupational groups. Industry is the business activity of a person's employer or their own business, whereas occupation is a description of the person's job or the type of work that they do. Of course, people on this webinar will be familiar with the distinction and that certain jobs are classified more readily or intuitively in terms of industry and occupation. So we wanted to provide rates comprehensively for both classifications. So major industry and occupational groups include all jobs in the U.S. economy. Detailed industry and occupation groups are subcategories of the major groups, and they define job types with more specificity. So suicide rates for major and detailed industry and occupational groups by sex. We compared the rates in each of those subcategories with the overall male and female suicide rates for the civilian, non-institutionalized working population. So in our limitations, you'll see that this excludes people with usual occupations that were military. It excludes people who didn't have paid employment, such as people that worked out of their homes. The results indicate significantly greater rates than the overall population in certain industries and occupations. We were able to examine usual industry and occupations for over 30,000 suicide decedents in 2021. About 80% of those suicide decedents were included in our analysis, again, after we excluded people with military occupations, non-paid employment, or their jobs were not specified. And these data come from death certificates that funeral directors fill out with next of kin. Males are overrepresented in these data because of the focus on the employed working population.
So turning to the results, this slide shows the rates of suicide by major industry groups among males and females. And the rates shown again are those with greater than the overall rate for males and females in our study. So overall rates were 32 per 100,000 for males, shown at the top there. And among females, the rate was 8 per 100,000. So suicide rates for males, females, or both were elevated in 9 of 20 major industry groups. So you can see the 9 shown here. Among males, suicide rates were greater in 8 major industry groups, and among females, the rates were greater in 5 major industry groups. And among males, mining topped the list at 72 per 100,000, followed by construction with a rate of suicide of 56 per 100,000. And among females, arts, entertainment, and recreation had the highest rate of suicide at 15 per 100,000. And rates were elevated among both males and females in 4 groups shown by italics in positions 3, 4, 5, and 8. So next, we're going to look at the detailed industry groups, and there's actually 254 of these groups. Suicide rates were elevated for males, females, or both in 31 groups, and what we're showing here are the top 10 detailed groups with the elevated rates among males and females. So among males, the detailed industry groups with the highest suicide rates ranged from 56.7 per 100,000 for people working in recycled material wholesale at the bottom of the list on the left, and ranged up to 147.5 per 100,000 for aerospace products and parts manufacturing at the top. And we also see coal mining in another detailed mining group, positions 5 and 8. And we also see jobs related to logging, fishing, hunting, and trapping in positions 3 and 4, as well as repair-related detailed industry groups in positions 6 and 7 on the left. And then among females, rates range from 11.3 per 100,000 in restaurant and food services at the bottom of the list to 46.5 per 100,000 in the performing arts, spectator sports, and related groups at the top there. And the latter detailed group was notably high also among males in the number 2 position on the left. So that rate was elevated for males and females in performing arts, spectator sports, and related. Also notable among females are 2 detailed groups related to beauty and nail salons, and several health-related areas, including veterinary services, skilled nursing facilities, and healthcare and social assistance. So now we're going to turn to the major occupational groups, and here we found that rates were significantly greater than the overall rates in 12 of 22 groups. And among males, rates of suicide were greater than the overall male rate in 9 major groups, ranging from 34.8 per 100,000 in the protective services group, 65.6 per 100,000 in construction and extraction at the top of the list. Here again, we also see high rates related to farming, fishing, and forestry, maintenance and repair, and again, arts, design, entertainment, sports, and media. And then among female, rates were elevated in 8 categories, ranging from 8.9 per 100,000 in major occupation groups related to sales at number 12 to 26.6 in installation, maintenance, and repair at the number 4 position. Similar to some of the other results, we see personal care and service and healthcare related occupations, as well as arts and design, having elevated rates among females. And then lastly, 5 major groups were elevated among both males and females, shown in positions 1, 3, 4, 5, and 9. Turning to the detailed occupational groups, of which there are 492, suicide rates were elevated for males, females, or both in 60 of these groups. And this table again shows the top 10 groups with the highest rates among males and females. So among males, rates ranged from 93.3 per 100,000 among artists and related at the number 10 position to 173 per 100,000 among agriculture and food scientists at the top there. We also see elevated rates again related to logging, fishing, and hunting, as well as entertainment in numbers 3, 8, and 10, as well as extraction and oil and gas in positions 5 and 7. Among females, rates ranged from 15.9 per 100,000 among driver and sales workers and truck drivers at the bottom, and then ranged up to 45.3 per 100,000 among artists and related groups. We also see elevated rates related to food and restaurants, including chefs and cooks, bartenders, and waitresses. And again, we see elevated rates as well among cosmetologists and massage therapists, as well as entertainment-related detailed groups such as artists, writer, and authors as well, and also among construction. So these results showed elevated suicide rates among specific major and detailed industry and occupational groups. However, all industries and occupations can benefit from a comprehensive approach to suicide prevention that Jody mentioned, especially given the large increases in suicide in the working age population over time. We think that a comprehensive approach is warranted. And at the same time, based on our results, suicide prevention can be targeted towards specific groups when it comes to decision making or resource allocation. The last time that we were here, we talked about CDC's technical package of policy, programs, and practices outlining the best available evidence for suicide prevention in communities. This time, we're highlighting our new suicide prevention resource for action, which has been updated from our technical package and includes many additional strategies and approaches for suicide prevention. This slide shows some of the workplace-specific suicide prevention activities. These include upstream prevention, such as promoting help seeking and creating crisis response plans, more downstream, and then interventions in between, including allowing time off and benefits to cover supportive services, training personnel to detect and appropriately respond to suicide risk among coworkers, and creating opportunities for connectedness to improve employee morale, among other benefits.
So limitations of this study and our previous studies based on the data sources that we have available to us. So in this study, we didn't control for other characteristics of suicide decedents aside from sex. We provided our results divided by sex. Some decedents were excluded. We were not able to analyze suicide rates among people with military or occupations or unpaid work. The numerator and denominator data for our rates, the number of suicide decedents divided by the population size, they're not a direct match for calculating the rates. As I mentioned, the usual industry and occupation come from death certificates, and the population data refer to the current population working size. Large confidence intervals indicate that some rates may be unstable. Those can be reviewed in our report and the supplemental files as needed. And our results are based on data from 49 states, which included the overwhelming majority of suicide decedents in 2021, but data were not available for Rhode Island and Washington, D.C. Here is our contact information. We're happy to answer additional questions. Thanks very much for the opportunity to present today.
Thank you both so much. As we conclude today, for those of you watching the webinar, I encourage everyone to go to www.workplacesuicideprevention.com and take the pledge to make suicide prevention a priority in your health and safety structures at your work or in your professional organizations.